السلام عليكم طلابنا المرحلة الثالثة. Today's lecture will deal with the fourth paramyxovirus and rubella virus and other congenital viral infections. The last lecture we talked about three members of paramyxoviruses. First, parainfluenza, respiratory syncytial virus, and mumps virus. Now we'll talk about measles virus, one of the very important group of viruses in pediatrics. It has only hemagglutinin and fusion, no HN, only hemagglutinin protein and fusion protein spikes. This is a picture of measles virus. Rubella or measles virus. Measles is acute, highly infectious disease characterized by fever, respiratory tract symptoms, and very importantly maculopapular rash. Complications are common and may be quite serious. The introduction of effective live vaccine has dramatically reduced the incidence of this virus. Measles is still a leading cause of death in young children in many developing countries, those in unimmunized children. Disease caused by measles called measles اللي هو الحصبة. Properties. It has two types of envelope spikes as we seen in the diagram on the drawings of measles virus in the beginning of this lecture. One with heme agglutinating activity 1H and the other fusion. Has single serotype, and hemagglutinin is the antigen against which neutralizing antibody is directed. So only one serotype. So when there is infection, there will be no infection at all, another infection. There will be lifelong immunity. Transmission, transmitted by respiratory droplets, just like the other paramyxoviruses. During coughing and sneezing, respiratory droplets is the main mode of transmission. Pathogenesis. Here's very important point. The first two paramyxoviruses does not cause viremia, very rarely, only localized in the respiratory tract, while mumps and measles they cause viremia, and there is characteristic feature in measles. We will talk about it now. Humans are the only natural host for measles virus. The virus gains access to human body via the respiratory tract, where it multiplies locally. First multiply in the respiratory tract. The infection then spread to the regional lymph node, upper lymph node, neck lymph node, where further multiplication occurs. Then there will be dissemination of the virus to the blood from the lymph nodes. Cervical lymph nodes disseminate the virus, and this is called primary viremia. Disseminate the virus, where the virus starts to replicate in the reticuloendothelial system. What is the reticuloendothelial system? It is spleen, liver, and lymph nodes, other lymph nodes in the body. Reticuloendothelial system. This is primary viremia. Till now, there is no symptoms of the disease. Then, secondary viremia seeds the epithelial surfaces of the body, including skin, respiratory tract, conjunctiva, where focal replication occurs. The virus can be isolated from these sites: skin, conjunctiva, and upper respiratory tract. This is after secondary viremia. Why there is a time between primary viremia and secondary viremia? Primary viremia spread the virus to the reticuloendothelial system, where the virus in these sites further multiplies and increases the number in order to produce its signs and symptoms. So this primary to secondary viremia, this time period, there is like a time for the virus to further multiplication and increase in number and causes more severe signs and symptoms. The virus produces, second point here, multinucleated giant cells with intranuclear inclusions are seen in lymphoid tissues throughout the body. Why we see multinucleated giant cell? because the virus has fusion proteins. Fusion protein causes multinucleated giant cell. The third point, involvement of the CNS is common in measles. So involvement of the central nervous system is common in measles. Symptomatic encephalitis develop in about 1 in 1,000 cases. So the main target organ are skin, respiratory tract, conjunctiva, and CNS. بالمناسبة موضوعين الاميونيتي والباثوجينيسيس ما نريد تحفظوها، فقط نفهمها فهم، يعني تجي عليه أكثر شيء MCQ. ما أقول لك أقعد أشرح لي كل الباثوجينيسيس and immunity. Never. This picture, development of the disease, shows development. Day 0 is the onset of rash. Before it, 7 days before, it will be prodromal symptoms, could be fever, and the incubation period 1 to 2 weeks. All of this incubation period, primary viremia, then secondary viremia, then development of symptoms, the development of rash and other symptoms. After years of virus infection and subsiding of the virus and disappearance of signs and symptoms, there might be development of CNS complications. We will talk about this. Measles virus, clinically, incubation period 10 to 14 days. Yeah, we can say 1 to 2 weeks. Prodromal phase characterized by fever and conjunctivitis. Fever, conjunctivitis, causing photophobia. Then most importantly, fever, conjunctivitis. Then there will be appearance of, second point, complex spots, which are bright red lesions. شوف بالpediatrics, any child when examined by pediatrician should have fever and rash. We should look distribution and rash, we will talk about it, and should examine the mouth, buccal mucosa, to look for complex spots, and we should examine the cervical lymph nodes, and we will talk about this. Complex spots, they are bright red lesions with white central dot located in the buccal mucosa. We will see it in the picture. Few days, 2 to 3 days later, macular papular rash appears on the, when starts on the face, then proceeds gradually downward to the body, to the lower extremities. So it starts on the face. Distribution here is different. The rash starts on the face. This is measles virus. See the child's face, the complex spots, they are red with very small, very small central dot, white dot in the center, seen to the against the molar teeth, and in the molar teeth, and in the upper part in the buccal mucosa. Most importantly here, complications of measles. One of the most important complications is otitis media, like other paramyxoviruses. Then secondary bacterial pneumonia. Why secondary bacterial pneumonia? Because measles suppress cell-mediated immunity and causes secondary infection. Third, primary measles pneumonia. Measles itself could cause pneumonia by itself, especially in younger adults, when occur in young adults, not in children. Fourth, acute encephalitis. Acute encephalitis occurs in about 1 to 1,000. After 1 month of measles infection, may develop acute encephalitis. Mumps virus, as we said in the last lecture, it causes aseptic meningitis, while measles causes acute encephalitis. Complication. Fifth, SSP, subacute sclerosing panencephalitis. Subacute sclerosing panencephalitis is very common and occurs insidiously after more than 10 years after measles infection. It is very rare condition, تقريبا 1 بالمئة ألف. Finally, measles in pregnancy. It does not cause congenital anomaly, but causes stillbirth. What is stillbirth? Is delivery of dead baby, dead fetus. Delivery of dead fetus doesn't cause congenital anomaly, only stillbirth. So the main complications: otitis media, most common, but the most serious and deadly is secondary bacterial pneumonia or primary measles pneumonia, acute encephalitis, SSPE, and finally in pregnancy, stillbirth. These are 6 main complications of measles. These are very important. This is the time period for development of complications of measles. هذا ما مطلوب من عندكم للاطلاع فقط. Diagnosis: mainly on clinical ground. There may be rapid test, serological test, also antibody rises greater than 4-fold in difficult cases, only in rare complicated cases. Treatment: there is no antiviral, could be vitamin A treatment, symptomatic. The most importantly is Ammar, measles vaccine, for prevention of the disease. As we told you about Ammar in mumps lecture, it is live attenuated measles virus vaccine combination with other vaccines اللي هم rubella and mumps. Ammar. All children should be vaccinated. Contraindication include also pregnancy and allergy to egg or neomycin because it is added to it in culture. هاي questions differential diagnosis of measles هاي نلقيها بالمحاضرة رقم 3 اعطيتكم اياها اللي عفوا المحاضرة رقم 5 سوري اللي هي بالبارفو فيروس 5th disease. نحكي نشوف هال 5 diseases اللي هي differential diagnosis of measles infection. Why measles cause secondary bacterial infection? What is the reason behind high death of measles infection? نحكي كل complications. هذا السؤال رقم 3 جوابه هو كل complications of measles. This is all about paramyxoviruses, 4 paramyxoviruses. Now we will start rubella and other congenital viral infections. It is an RNA envelope virus in Toga virus family. Rubella causes German measles اللي يسموها الحصبة الألمانية and causes also congenital rubella syndrome. Properties of the virus: it is single piece, not segmented, single stranded RNA virus, icosahedral nucleic capsid, lipid envelope. It has very similar to paramyxoviruses. The only difference in rubella, most important difference, it has positive strand RNA. All paramyxo and orthomyxo are negative strand RNA. جماعة الإنفلونزا والبارا إنفلونزا كلها negative strand RNA. الروبيلا positive strand RNA. Therefore no variant polymerase. هنا تجيك هواية بالMCQ كل شوية نقول the virus that has RNA that is infectious when purified. يعني مباشرة هذا ال RNA يشتغل as messenger RNA. من هو؟ واحد من عندهم هو الروبيلا فيروس. روبيلا فيروس. Surface spikes contain heme agglutinin. Only heme agglutinin. هنا الديفرنس الآخر only heme agglutinin spikes. اللي هي نستفاد من عندها in the diagnosis. We see here heme agglutinin spikes يسموها glycoprotein spikes inside single-stranded positive strand RNA. And it is enveloped, of course, envelope virus مثل الميكسو والباراميكسو. Transmission أيضا مثلهم transmitted via respiratory droplets. And transmission الآخر اللي هو مهم جدا transplacentally from mother to the fetus. Disease occurs worldwide mainly during spring كلش هواية بالربيع. For several years CMV rather than rubella has been the leading viral cause of congenital anomalies. ليش CMV أكثر من الروبيلا؟ أخذت محاضرة يمكن الساتوميجالا فيروس ويا الهربس فيروسز. CMV does not have vaccine. لكن rubella nowadays is global eradication by vaccine اللي هو الأمار measles, mumps, rubella which is live attenuated vaccine. Transmission in the first trimester of pregnancy 85% rate, and in second trimester of pregnancy 16%. will affect very rare in the third trimester. ليش؟ كلش هواية in the first trimester because of the process of organogenesis. الأورجنز بعدها تتكون فأي damaging effect from the virus which is teratogenic virus. روبيلا هو teratogenic virus مثل السي ام في. روبيلا والسي ام في teratogenic viruses causes damage to the organs of the fetus and ends with congenital anomalies. إذن diseases can be divided into two main groups: A postnatal يعني بالchildren and B اللي هي congenital. postnatal rubella pathogenesis هاي فقط تفهموها فهم. Children and adult infection occur through the mucosa of the upper respiratory tract like the paramyxoviruses. Rubella incubation period about 12 days. Initial viral application in the upper respiratory tract, then multiplication in the cervical lymph node. دائما نلقي بالروبيلا إذا صار symptomatic retroauricular lymph nodes. retroauricular يعني بعد الإذن اللي خلف الإذن lymph nodes examination we see a large retroauricular lymph node. Then viremia develops after. viremia ايش راح تسوي لنا؟ راح تسوي لنا rash, skin rash. We see that development of antibodies against rubella coincides يعني فد وقت with the appearance of rash, suggesting immunological basis for the rash. إذا الراش هنا مرات ما نلقي بيه بالسكن راش، ما نلقي الروبيلا فيروس، ما نقدر نعزلها مثل الميزلز. لكن الروبيلا هنا ما موجودة لأنه احتمال هي immunologically mediated skin rash. Why? Because antibodies were found. Exactly, development of antibody coincides with the development of rash. After the rash appears, the virus remains detectable only in the nasopharynx, where it may persist for several weeks. ما يروح ينتهي يبقى الفيروس for several weeks in the nasopharynx. No complete recovery till now. Till IgG antibodies usually persist for life. من تطلع ال IgG antibody completely kill the virus, and these antibodies persist for life. One attack of the disease confers lifelong immunity, and only one antigenic type of the virus exists. Only one. مثل الميزلز والمامبس only one antigenic type. هذا ساعدنا كونا فاكسين ويساعد بأنه confers lifelong immunity. ينتقل from the mother to the fetus. الاميونيتي فتساعده in the first 6 months of life. قليلة الانفكشن نلقيه مع الميزلز والروبيلا والمامبس كلها very rare in the first 6 months of life. So infection with rubella there will be never another or recurrent infection. Never ever. Immune mothers transfer antibodies to their offspring, who are then protected for 4 to 6 months. 4 إلى 6 أشهر. Then immunity مثل ما حكينا antibodies transfer from the mother to the fetus. Clinically rubella اللي هي German measles حسب الألمانية low grade fever, then macular papular rash appear on the same day. Very small period of time, only 3 days. Rash on the face extend to the trunk, then not more than 3 days. No features of rash pathognomonic. إذا ما نقدر نقول بأنه هذا الراش هو روبيلا يعني diagnostic unless epidemics. مرات تصير epidemics of rubella في مكانات محددة عند الأطفال وتنتقل للنساء الحوامل، وهذا كلش خطر. واحدة من الكرايتيريا قلنا posterior auricular lymphadenopathy is characteristic. Posterior auricular lymphadenopathy. Congenital rubella. The importance of rubella is as teratogenic virus. When non-immune mother, not vaccinated, no previous infection, is infected during the first trimester, especially the first month, significant congenital malformations can occur as a result of maternal viremia. راح ينتقل الفيروس from the mother through the placenta to the fetus and causes fetal infection. Rubella infection also result in fetal death and abortion. مرات ما نعرف بيها الروبيلا، ما نقدر نشخصها congenital لأنه بالبداية صار fetal death and very early abortion. Congenital infected infants have significant IgM titers. عندهم IgM very high الانفنت إذا انولدوا and persistent IgG high long after maternal antibody has disappeared. حتى لو قلت أو الانتيبوديز الاي جي جي نلقيه عالي بالchildren ونلقي عندهم IgM titers. An apparent maternal infection طبعا اكو نسبة كلش عالية، احنا حتى هناك عندنا الروبيلا هو اكثره هو an apparent infection او subclinical infection which even اذا صار عندها an apparent واللي هو كلش هواية، يمكن مرة يوم واحد فيفر يصير عندها يوم واحد وما تحس بيه، ماكو راش نهائيا، ومرات ماكو اي سيمتومز لا فيفر ولا راش، فكل هذا ايضا ممكن الفيروس موجود بالبلاد and causes congenital anomaly as well, the same as if she has symptoms. These are the main هذا very important. These are the malformations اللي هي بالبرين microcephaly، الهارت congenital anomaly any congenital، بس هي most commonly PDA patent ductus arteriosus اللي هي تبقى بين الارتري والفين and in the eye causes cataract هو بياض العين، وهذا بسبب congenital rubella. إذن the heart brain and the eyes هذا شي يسموها classical CRS congenital rubella syndrome triad ثلاثية triad. Cataract, cardiac anomalies and deafness or microcephaly. هسه تجيكم كيس يقول لك child أو infant newly delivered 1 week here نشوف haziness in the eye, abnormal heart sound and the fetus أو the infant is irritability أما بسبب microcephaly اللي يسوي عنده mental retardation أو بسبب الdeafness ما يسمع في صوت irritable. فتشرح لنا إياها شنو سببها، ليش سبب abnormal heart sound could be congenital heart disease mainly PDA. Haziness in the eye means cataract. Irritability could be because the mental retardation or deafness. This is very important. Diagnosis الكالتشر هذا طبعا كلش قليل وهاي بنشرحكم عنه بالعملي إن شاء الله. Observing presence of IgM antibody is very important by ELISA, and IgM antibody rise either positive or rise titer by IgG antibody. شو يعني rising titer؟ ما اقدر اسوي IgM او يطلع نيجاتيف، فاسوي IgG واشوف تايتر ايش قد يعني المقياس مالته، بعدين ورا اسبوعين اعيد الاي جي جي نفس المختبر نفس الكت اجربه. الاي جي جي اذا صعد greater increase more than 4 to 8 folds increase معناته هذا active infection not previous infection. active infection. If recent infection has occurred مرات suspected to have congenital أو have rubella infection، فشي حيسوي لها amniocentesis، يسحبون الامنيوتيك فلويد under ultrasound guidance ويفحصوه for viral infection. Reverse transcriptase PCR can be used to detect rubella virus nucleic acid directly in clinical samples. أي sample حتى لو amniotic fluid. viruses rubella CMV حكينا عنهم. Main consequences: intrauterine death, first IUD, intrauterine growth retardation, prematurity, congenital defect, persistent infection after delivery، يبقى فترة طويلة عند الانفكشن ويصير recurrence period وخصوصا CMV. Why some viruses causes congenital defects and others not؟ انفلونزا ممكن يصير يعني يصير عندها فيفر ويصير during pregnancy بس ما يسوي congenital defect. Depends on first the ability of the virus to be transmitted to the fetus. الروبيلا الCMV الميزلز هذول ينتقلون خلال البلاسنتا other viruses influenza para-influenza ما ينتقلون through the placenta. Then ability of the virus cause damage to the fetus يعني teratogenic effect. روبيلا والCMV عندهم teratogenic effect فيسوون damage to the fetus. The stage of gestation هاي حكيناها. stage of gestation اللي هي in the first trimester due to process of organogenesis increase the risk and damaging effect of the viruses. أخير شيء how to diagnose. أهم شيء احنا عندنا إلايزا ممكن IgM mother or IgG rising titer يعني ناخذ أول أسبوع وبعدين ورا أسبوعين ناخذ ال IgG ونشوفه increasing titer. Postnatal most importantly is IgM in neonate. أول من ولد suspected congenital rubella IgM. Why IgM not IgG؟ لأنه IgG ينتقل from the mother to the fetus. هو الوحيد من الانتيبوديز اللي ينتقل. ف could be previous infection vaccinated فممكن. لكن IgM in neonate definitely acute infection in neonate. هي rubella infection. Prenatally, during pregnancy, using amniocentesis, detect the virus directly using molecular method, by PCR.